From the time I got in the parking lot to the time I checked in to the receptionist's desk, I just felt comfortable, and I felt like I never was hurried. I always felt like they gave me time.
The Mitchell Cancer Institute was selected to participate in the oncology care model. The oncology care model focuses on providing high-quality, cost-effective care that is centered around the patient.
So you have the patient who's the center of our care, and you not only have the surgery, the chemotherapy, the radiation, and the toxicity associated with that, but many patients have social issues, financial issues, transportation issues. So if you take all of those issues, it makes it incredibly complex for a patient to go through cancer care. It's like climbing a mountain for them.
It became clear very quickly that we needed a tool to help customize the level and type of services required for each patient in the most efficient and effective way. It was at that point that I started working on an Acuity tool to help figure out which patients were the highest acuity at any given moment.
Without an Acuity process or an Acuity tool, I wouldn't have anything to measure or gauge. If a colleague came in behind me, they could evaluate a patient by the Acuity tool without even knowing them. They would know how much time they're going to need to spend, what level are their treatment, what level is their disease, and make sure that the patient's needs are met.
There aren't many tools like this out there for oncology, so we started from scratch and we developed the tool based off of 11 specific areas of a patient's medical treatment, diagnosis, psychosocial factors, family factors. The one thing that makes this Acuity tool different than most is that we added a 12th factor. We felt like we needed to look at the patient in a more holistic manner. The 12th factor is the clinical assessment of the care coordinator, also known as a nurse navigator, who knows that patient well.
So a care coordinator, it gives me the ability to connect and be that advocate for the patient so that whenever they come in, I tell them this is what's going to happen here, this is what's going to happen at this station. And so I walk them through the process to give them more peace.
I can only imagine there had not been someone there that I could have known I could ask that person anything that I had a question about. It would be so scary. You're uncomfortable, you don't know what's going to happen, you don't understand anything about what's going on except you know you have cancer and you know you're there to get a treatment. But if you have somebody there that's going to walk you through the process, it just makes for a smoother experience. This tool has certainly allowed us to monitor and measure the progress of each of our patients.
Essentially, if you can think of a complex automobile which has incredible power and all these moving parts, but you simply have a dashboard where you have all the information you need right in front of you to drive that car. That's what this project does, is it creates a dashboard so that the caregivers can take all this complex information and have it right in front of them.
Through implementation of this tool, we have seen and we've determined how our patients are benefiting from it. And that's truly the bottom line. They make you feel so great. I mean, they act like they really love you. I mean, that's what you feel like. You feel like you're in a loving situation.